Welcome to the ICT&health Podcast with Lucien Engelen and Jessica Workham.
Jeroen, welcome, my friend. Where in the world are you at this very moment?
Well, in the place I call home in Amsterdam.
Well, that's good. And home is where the home is, of course. Yes, Amsterdam. That's a great place, of course. And we know each other for a long time already. We together during my tenure at Radboud, we collaborated in your tenure at Philips on numerous projects with all in the base, trying to get a hold on what patients want, what patients need, and how to facilitate them. What are the things that you're working on right now? And maybe also to introduce yourself a bit briefly at first as well.
Yeah, well, I decided, and that's already 16 years ago, to change my career trajectory. I started my career largely in Citibank. That's where I learned a lot. In the mid-90s, we really started with internet banking, with customer analytics.
And you were there when internet banking started.
I was there. I was leading Tech Lab, and then I started my own company, built it into a pretty large company. Still is a very large company today, in IT service, primarily for financial institutions. Mm-hmm. And then my daughter, when she turned 12, she was diagnosed with type 1 diabetes, and I got confronted with a couple of things. And she was treated at one of the most advanced hospitals in the US. But it struck me how siloed the different disciplines were that were concerned with the care. And then it struck me as well that there was very little technology, especially not information technology, let alone technology to measure stuff. There was no therapy. So I felt maybe I can bring my experience that I built up in large-scale systems to another industry. And then I decided to join Philips. And my last role at Philips was Chief Innovation and Strategy Officer. And that put me in a position to work with some brilliant researchers, but also with some of the largest healthcare systems or some of the most advanced healthcare systems in the world. So it gave me a good view of where the industry was and also what the issues were in that industry. So I decided to dedicate the rest of my life to help innovate because I think the opportunities have never been greater than now, given technology, and not just information technology, AI, but also if you look at the world of diagnostic, the world of therapy. We found out more or less by accident that GLP-1 is a wonder drug for sort of ailments, but we have CAR-T now, so we can program the immune system. We have CRISPR. We can program our DNA. We can generate stem cells, and we can turn these stem cells into dedicated cells. So there's a whole world of opportunity looking us in the eye, and I think now is really amazing period to tap into that. So I'm involved both in investment in health tech companies, and a couple of them here in the Netherlands that I think are very, very promising. But I'm also advising a number of healthcare systems, for instance, DASA in Brazil. But also I'm working with Avidia, one of the largest networks in Europe, and Synoptis, one of the large ophthalmology chains in Europe. So I'm still,
still busy as it can be.
Wherever I feel I can add value, and wherever I feel people are interested in, looking at how innovation can help them become a better organization, I'm always willing to support.
Of course. So with all the things at hand, all the technologies, all the opportunities, and all the pressure that's kicking in, not only within healthcare as an industry, but also in society, one would say with all the elements present, that's a no-brainer. Everything works. So rolling back a bit to our collaboration back in the days where we thought we create one platform, first of all, for people living with type 1 diabetes, like your daughter, Kim, and then subsequently broadening that to many, many other diseases. It was a dream, and it still is a dream. I think a couple of organizations have tried to do that. I think the guys over at Google with Google Health had their share in it. I think that Microsoft Health back in the days tried to create such a big program for it. None of which have been succeeded, and nor did we succeed. We've learned a lot of things, not only within Philips but also within Radboud University Medical Center, and also had a great contribution to the essence of how do you run these kind of programs. But what's different between then and now, and why is it that with all the opportunities that we have and the technologies present, that these things still are not tangible, operational, other than like small point solutions in particular flux?
You can also ask the question differently. Why is it that in financial services, where I started in 95 with internet banking, the whole world is now connected and you can pay without even touching a device anywhere in the world? And why didn't something like that happen in healthcare? And of course, we're all been looking at it, thinking about it, and there are a couple of reasons. I think one of the most important reasons is that people say healthcare is not finance. That's true. You're dealing with lives. But if people say, privacy and security, I said, that problem...
Same as in finance.
Yeah, that problem has been... So let's focus on the clinical aspect. So I think we're operating in an industry that is therefore conservative by nature. But I think the most important thing is the industry is very fragmented, super fragmented. Yeah. So in any market, whether, even in the US, although you have some very large systems like Kaiser Permanente or, Intermountain, you name it, there are a couple of really large systems, but most systems are small. You look at practices, GP practices. So it's a widely scattered landscape, and each of them will never have the wherewithal to do something big. Mm-hmm. So if two big banks can come together, or all the Dutch big banks can come together and say, we built a payment network, and, why would each of you do it? And then you sit with 6 banks and you solve it and you do it. If you try to do something like that, let's say we do a shared data network, then try to get all the players together and aligned on a single program, and then try to get it properly capitalized, because we're talking major investments. Because in the end, and I think that's also what I've seen, why these programs really don't work, is because in the end, every participant is still just looking out for their own organization.
Yeah,
they're incapable of transcending their organization and say, let's participate, because in the end, everybody will win. And that happened with ATM networks, because everybody had their own ATM network in the 90s. And then somebody said, yeah, but if we get together, then we can offer way more services, way more access. And you know what? The cost will go down because we share it. And that's, of course, what happened.
But of course, that's what happened, Jeroen. On the other hand, I think the same story is true for healthcare as well. There's a number of networks in the Netherlands. Just let's take the Netherlands as an example. There's networks as the STZ. There's networks like Santeon and others who came together and said, we got a shared issue, challenge, opportunity. Let's get these things up and running. Second of all, every healthcare organization, might it be hospital, home care, what have you, all have to keep all their IT services up and running. So I think that the essence of the need, just like with the banks back in the days, is the same. But for whatever reason, we don't get into that next step to say, let's do it.
Yeah.
And of course, it's about fragmentation. Yes, there still is, again, in the Netherlands, 90 different hospital organizations still. On the other hand, the pressure is mounting gigantically in all kinds of issues. So what should change? What should change to get these things up and running? Is that culture? Is that ego? Is that I don't think it's about finance. It's all of the above. Yeah, sure.
Yeah, so I think on the ground floor, people are always willing to work together.
Sure.
And then you look.
We've seen that with the pandemic.
Yeah.
Within 24 hours,
Exactly.
everything worked.
We're totally capable of doing it. So there's no longer a question of
Yeah.
can we do it? Because we showed
Sure.
to ourselves and to the world that we can do it.
Yeah.
But then when the urgency disappears, everything falls back to the old structures, the old processes, the old systems, the old KPIs, the P&L that needs to,
Business cases.
business case where people are risk averse. They're very risk averse. They're very myopic in the sense that, listen, we need to keep our head above the water. We don't have time for stuff like this. We don't have capability for stuff like this.
Yeah.
And then it's very easy to say, okay, let's just do what we're doing, or, let's work together with a couple of guys. But what you don't see is, for instance, what Mayo Clinic has done. They said, we go all in.
Yeah.
This is going to be our business. Our business is going to be clinical services grounded in data. And what we're going to do is we're going to connect a number of other healthcare providers in our network, just like the banks did. And then we're going to invite innovators in. We're going to give them a secure environment in which they can test their innovations. We can make sure that they can fit within the workflows of hospitals, that clinicians can put their hands on it and essentially say this works or it doesn't work. And that when it works, we can scale it up. And if it doesn't work, then we'll go on to the next thing. So you create an environment that has its own capability to grow, to attract, and to scale. And that's so different from how most organizations operate and plan and invest and deal with risk. Because Enrico and team just took a very bold move. And the board said, we're behind you. We think that healthcare is going to move in a different direction. And it's not for nothing that, I don't know, for the 10th year in a row, they're the number one healthcare provider in the world.
Yeah.
And I hope that people get inspired by organizations like that.
I think many people are inspired with everything that's happening within Mayo's and also Cleveland and others. Also from the Netherlands, there's numerous people that have traveled over there and got inspired and got back, and still this hasn't happened. So let's do a thought experiment here, Jeroen. Let's take not like the smaller scale of the Netherlands. Let's think Europe. Who in Europe would be capable of pulling something like that off on a scale that's feasible enough, that's sustainable enough to pursue, and also has the statue of eminence, let's put it like that.
Yeah.
Who would come to your mind then?
Yeah, well, I'd like to take an example that's not in healthcare, but in Europe, and that's CERN, the research organization. Yeah. That's properly funded, that has the best minds in that space.
Yeah.
And that creates research that's absolutely world-beating. And I think there's another example of kind of consortium-led leader, and that's Airbus. So there are a number of players in Europe that have shown that they can do things at scale in an ecosystem perspective. And I think there are also big players in Europe that will be capable to get together and that could pull this off. But then, I always say when I was at Citibank, the IT budget was relatively low compared to what it is now. It was $7 billion. So you're talking completely different numbers.
And that's how long ago?
This was in '95, so
So that would be now something like
well,
how much?
definitely double digit. But
Yeah.
so these numbers
Yeah.
are serious. So
Sure.
so I think if you want to do something, you do it. At least you start with something that ends up at that kind of scale.
Yeah.
And I think we're forced into this because of what's happening in geopolitics.
Yeah.
I was talking to some organization. We talked about, well, if we do AI, should we do it with, open AI or Anthropic? Or although I like Anthropic, I definitely don't trust open AI. There's a bunch of
I'm in the same boat. Yeah.
So there are one or two credible players in Europe. Why don't we double down then on healthcare and say, okay, let's work with these guys, fund these guys, get the GPUs in place, let them focus on defense, healthcare, and renewable energy. So the three top topics.
Yeah.
And if Europe is really outstanding in these three topics, we're outstanding in the world. So,
Yeah.
but why not go all in? Why not basically? And then there's a lot of European talent in the US.
Oh, sure.
Jan LeCun came back from Meta to France, and there's a bunch of other top brains in this space that I think in current political climate would be more than happy to come back if there were something like CERN or healthcare AI.
Yeah. I cannot wait till the day that happens, but I also think it has something to do in the way and the scale that we tend to innovate, isn't it?
Yeah.
In terms of we think too narrow-minded. An ecosystem for a hospital is their ecosystem with their GPs and the home care companies and stuff like that, but nobody's thinking in that bigger scale. And then also this touches on the things that you've written down in your book. Where you at one point at least say there's different speeds in everything that happens. So if we take that aspect and that element out of your book and project that on this topic that we just had, like who and how in Europe could we pull this off? What would your suggestion be in that, and how is the way that many healthcare organizations still, not only in healthcare, by the way, are innovating in a totally, let's say, 30-year ago kind of fashion where the world has changed?
Yeah.
Completely.
Well, let's start with that and say, okay, how is it that it's so hard to innovate in, let's say, even advanced hospitals?
Yeah.
And then in the book I describe three layers, if you will, and
we'll put a link, by the way, in the show notes.
So the outer layer is where we most of the time live. That's the operational. We do our work. We try to improve our work. We service patients. So that's where we live most of the time, and that's where people are willing always to improve and even to innovate. But then there is another layer that goes at a completely different speed, and that's our systems. Okay, we have our EMRs. So, okay, you want to make a big change to your EMR? That's 100 people for the next 3 years. So you're locked in. If you want to change the way you set up teams and the structure of your organization, where you say, okay, I'm going to move to multidisciplinary teams, it's apparently working in cancer, so maybe we can apply the same principle. That's another 2-3 year project to just make these changes. The way you remunerate people, so the systems, the processes, the rules, the regulations, they're all a big break on this. And then there is even a deeper layer, And that's really the mindset. And that's about how committed, okay, I have a big ambition. But if you look deep in my heart, do I have the guts, the drive, and the will to fight for that ambition? Because I'm going to be held back left, right, and center. There's going to be people that don't want to change. There's going to be people that say, oh, but compliance. And there's people say, we don't have the money for this. So if you want to make a structural change, you better be a very, very driven person. And
welcome in our world, isn't it?
And then secondly, most of us come from a world of control. That's why you split an organization up in departments. You give a department a goal and a KPI, and you have your process and blah blah blah, and it's all about control. Now here's the dirty secret. Healthcare is a complex dynamic system. There's just no way you can control everything. You cannot predict accurately how many people are going to come into your hospital. Yeah, you're just not going to be able to predict accurately what's going to happen in your hospital today. Because things happen. You can roughly have an idea. So you have to let go of the idea that you control everything. And you have to move to a mindset where you say, how can I influence? How can I influence outcomes? How can I influence optimal, the flow of patients in my hospital? How can I influence outcomes for patients? How can I influence the way that my employees bring out their best to do whatever is good for us and most importantly for their patient? So traditional ways of here's your detailed job description, here's how you get paid, and here's where you're going to sit in the organization, and here are all the rules and manuals that you have to learn, are not exactly inviting people to step up. And I don't know if you watch the series The Pit, and if not, I would recommend everybody to watch it. It's
and why is that?
It's an emergency room. A season is 1 day in an emergency room.
Yeah.
And it gives you a really good sense of nothing is planned there.
I know.
Everything is done on the fly, but there is also a structure. They found a very flexible way to deal with whatever emergency. And a lot of
it's more like scenarios that you have in you. Yeah, they work with scenarios.
Exactly. And they constantly make assessments of what's the probability. If I do this, what can I influence now? Should I do it now, or can I do it in 10 minutes? And I've heard that it's really an accurate series, but there is a mindset there that I recognize and would embrace on a larger scale. Where you say, there are guidelines and there are guardrails and there's things you can never.
There should be. Well,
but there should be way more leeway to do things that you judge as a professional to be the right thing. And secondly, there should be room to experiment because we don't have space to experiment. Yeah. And I think these are the major changes because if deep in your deepest layer, you believe that you have to control everything and you cannot let go and you're not willing to trust, but trust and verify, it's going to be very hard to deal with the dynamics. And the dynamics will increase because we're not going to dramatically expand the staff in our healthcare system
at all.
No.
The number of admission rates for nursing school, Jeroen, in the past 5 years
will not go down. So these are givens.
That's it.
And then you say, well, maybe the rigidity and the fragmentation of the current system, the way we deal with process and the way we deal with job descriptions and is maybe no longer suitable for the dynamics of the world we're living in and the opportunity that the technology will give us to make really big leaps. And I feel we haven't fully reconciled both the ability of the technology, and I'm also talking biotech and new types of therapy.
Yeah, sure.
And that require completely different way of doing clinical trials. We cannot afford a 10-year, period for something that has been in essence proven, but may now be proven for a certain segment under certain conditions. And if we move to personalized medicine, the whole model will go upside down anyway.
Yeah, I think we can talk for hours about personalized medicine, or rather, I would like to talk about personalized health in the end, because we wait until something's the matter and then we try to fix it. For the last couple of minutes for this podcast, Jeroen, if all of this is true, which it is and is happening, I on a daily basis see how AI at this very moment within many, if not all, healthcare organizations is being approached as a tool, and a tool for X, Y, or Z. And the notion that, as it is in my perspective, I'm curious if the same is true for you, this is not a tool, this is an infrastructure. And that infrastructure is completely going to overhaul not only all those protocols and those control aspects that we have in it in a totally different way. So my first question on that is healthcare ready for that? Even though I think I know the answer, but what could we do about that? And the second part is, where do you think is AI going to bring the most benefit?
Yeah.
Is that in terms of drug discovery, disease management, or maybe more on the, let's say, the admin work kind of aspect? And
all of the above, but and of course, because I've been with you for the last 15 years. So
of course.
So first, you're totally right. AI is not a tool. AI will be your companion. AI will be your companion.
Yeah.
You will work with AI in whatever you do. And any organization who just sees it as, the extension of their EMR doesn't really embrace the full potential of the technology. It's a cognitive technology that can do things humans cannot do, period.
Yeah.
A human cannot look at 100 factors that may influence your health. We can look at 2, 3, maybe 5 or 6, and then it stops. But we all know that there are a whole bunch of things that influence outcomes. And part of them are clinical, part of them are not clinical. So I think the first thing that you have to recognize, AI can do things humans cannot do. AI can see patterns humans cannot see. And AI can give you a sense of super complex stuff that we never could make sense of. And then if we map that to healthcare, then of course you say, okay, if this tool is so damn powerful, as you say, then it can be dangerous as well. And I answer, of course, yes. Therefore, you have to understand how to use this technology. You have to understand how to manage this technology, what the guardrails are, but you also have to understand how you can unleash its power. So you start with the simple stuff, the stuff that nobody likes. And that's where the traction is right now. You clinical notes, discussion with your patient, transcription,
summaries. Yeah.
Summaries. Are you eligible for this treatment? All the stuff you start with the shit nobody likes to do. And then you already have a major win. But that's making stuff more efficient. And I don't think you ultimately win by making things more efficient. You ultimately win by making things way more effective. And what do I mean with that? Is the opportunity to create way better outcomes for your patients. And to give your staff much more opportunity to do the job they really love to do and care for patients. And that you have to kind of wire in the way, not just you train your people, but then you come down to all these things. Are the systems supporting this? Do I have the data available to do this? Can I now start working in teams? Can I use these tools? To what extent? What can I do? What can I not do? And then you start looking at where. And of course, diagnostics is number one. Because what we're doing is you go to radiology for your image. Then you go to the lab for your liquid biopsy. You go to the pathologist. And you go to a monitor. And guess what? They're all perspectives on the same thing.
Sure.
So
Yeah.
the first thing you're going to do is have a multimodal. There's all these things together. Look at what's going on with this patient, and then there's a lot of contextual information, and there are new biomarkers. There's
Digital biomarkers.
Digital biomarkers. Your phone is full of biomarkers. The way you talk, the way you type, tells you a lot about a lot of things.
Your voice even. Yeah.
So, and then we all, of course, you're also wearing the ring.
I never do that.
Rings.
I never do that. Why is it?
That's not for you. So I think.
Yeah, it totally makes sense. It totally makes sense.
We have a richer diagnosis, but I think the huge step is going to be in therapy, and that's going to be not just what AlphaFold did for protein modeling. It's going to be molecular modeling. It's going to the tools we now created for cell therapy, the tools we created to influence the immune system, the microbiome, and we've been talking about this stuff for 10 years. We've been at. You took me to these sessions in California, but I think it's maturing. This stuff, What
I always say it takes between 7 and 17 years, Jeroen, and it depends a bit on the research that you trust about it. But we've seen this happening. It always takes way longer than we think it is.
But then it goes fast.
No, not only fast, but it also what's the saying again? Roy Amaga's law.
Overestimate the short term.
That's it. Yeah. So last question.
Yeah.
You've been around on board level, executive level, and all these things together. What I see is the struggle within organizations, like who's responsible for AI? And then the clinical staff says, well, we are, because we're the most important kind of people. Then IT says, no. We are, because we need to fix all of that. And then the nursing staff said, well, wait a minute. We outnumber you guys 1 in 10. So what would you say? And it's not like in terms of the ownership, but who should be at the helm in guiding the organization through this stormy time that is only just got started, I think, in my opinion. And what should C-suite do about that to make sure that happens?
Okay, I think number one, the C-suite is strategically responsible. So they have to embrace this. They have to highlight that this is important. And then all these people that you mentioned have to be in the design of this, because they're all
whole system in the room.
It's not like we build a system for you.
Yeah.
I tell you what the big difference is. They're going to be part of the system. So this is not, sit, can I have your requirements? Then wait a year and your requirements will be implemented, and it will never be what you really wanted because you couldn't really articulate it and we could actually not really build it. No, you're shaping your own environment here. Here is a technology that can tune itself to you. Here's a technology that you can give input that can become better because you tell it you should do it this way. So this is not an IT. Now, you need IT because it needs to integrate with...
You need energy as well.
Exactly. And HR needs to be involved, yes, because
Sure.
people need to be trained and exposed and guided through this. But the people at the front, the people who are going to make the biggest impact, and these are the people that you just mentioned, the clinicians, the nurses. And they're not the back office staff. They're the clinicians and the nurses, the people that deal with patients every day. these are the most important people. That's the core process of any care providers. And it has to be deeply embedded there. And that you can make stuff at the back more efficient, that you can do your finance and your administration. Definitely do it. Do it first because it's straightforward. But that's not where the revolution happens in healthcare. It's just a step towards empowering these people at the front to take this technology and make it theirs. And not, I want this. No, you shape it yourself. That's you know it. You build agents.
And it's not only shape it. You said something very important a minute ago as well. You are part of the system that you're building.
Yeah,
it's not something that is going to be built for you. It's you will be in it. And the interesting thing, the other day I've seen an ad of a website that's called AI Rents Humans. It's a website. I need to dig it up. I will put the link in the show notes.
Yeah.
Where AI says we need humans physically to go
here. Yeah.
You know, to go there, and there's profiles of people say I can do this and that, and this is my rate.
Yeah.
So AIs are renting humans to do the physical stuff that they can't.
But
So-
I can see, we're humans and we want humans to care for us, period.
Sure, always.
That's a principle. But then
Yeah.
these humans can be super effective and do what they're really good at, which is empathy, judgment, dealing with the specifics of this context you're in. But all the complex stuff, comparing it, calculating it, measuring it, that's all the stuff we're not good at humans. We cannot look at 500 data points simultaneously and make a judgment. We cannot do it.
And there is no physician and there's no nurse that wanted to become an Excel fundamentalist.
No.
Jeroen, thank you very much. It's been a very, as always, very interesting and fruitful discussion. It's all about passion. And the one thing that I keep asking myself during this a bit longer than half an hour, should we take another stab in building that platform for Kim and the Kims of the world?
I would love to do that with you, Lucien, because I think you were onto something.
Let's have a coffee on that. Thank you very much again, and
pleasure.
stay safe and be well. Thanks, my brother.
Thanks, you.
Bye-bye.
Bye.